Yeah,
Need a bag.
I was going to check on him. I'm getting a headache. Oh my gosh, Chris.
Alright.
Watch out for that space heater over there.
What's that?
Watch out for the space heater.
I'm just gonna put these around you.
room.
Yep.
Heater's unplugged.
Yep.
Heater's unplugged.
Or off or whatever. Okay, where we at?
I think we should probably get out.
Yeah. Alright, let's get on the backboard here.
Yep.
So what's your name?
Kyle.
Kyle. In a second here, I'm going to have you help roll your friend towards you, okay? We're going to get this board under him.
Okay.
Alright?
Yeah.
I'll take over compressions after. You ready?
Okay.
Ready? 1, 2, 3. Let's go.
On compressions.
Go, Kyle.
I'm trying to feel my head.
Yeah,
right
go
now.
step outside real quick, okay?
Okay.
We gotta go. All right. We got 2 patients there.
Alright, ready? 1, 2, 3, out.
Guys, I feel like I'm gonna pass out a little bit.
I guess we got to do some training on this, huh? Okay. Okay.
Pull it in and then
Hold on. Take this. Pause. Lift that up. Squeeze red handle. Now lower. Let go. There you go. Now you're out in the environment. Good job.
Can we request another ambulance?
None are available at this time.
Okay.
Nice try.
You want to check on him in a sec?
Okay.
Alright, let's get him.
Going in.
Yeah. Can you grab the blood pressure cuff, please?
How long were you in there for?
Oh, it's probably 10 minutes.
Okay. What do you feel like right now?
Really like I'm gonna throw off. It's like I feel really hot.
We need a bag.
All right.
Oh, I feel a little short of breath.
Okay.
Alright, do you think you can
We're gonna
walk
get you
the
some
bag?
oxygen here, okay?
Okay.
Yeah,
I'll
but
take
we
the
don't have
monitor. I'll be
we
Officer
need
Barbrady. You go.
another airway, but I can give the rest of breath.
Alright,
Let me
we're
know
gonna
when you're
get
at
moving to the
30.
ambulance,
Yeah,
alright?
yeah, let's go. Hold out.
Let me know if we're going too fast.
Okay. I'm gonna go over them. But Brendan, how are you gonna treat this patient?
We're
Patient
gonna
number
get
2.
him on 15 liters non-rebreather.
And where are you gonna put him?
Oh, well, we're gonna get him in the ambulance as well.
Okay. Perfect. You're done. Make it happen.
All right.
Okay. Go down. Squeeze the red handle. Let me know when you're ready to stop.
Up.
Oh, 1, 2, 3. Okay. We'll transition as smooth as you can.
I'm gonna hop in so I can take the airway.
Take over CPR first. Better answer. Good job. Good. So the video knows it is approximately 10 degrees outside.
Monitor.
Someone get on the
Glasses
airway.
and beacon.
Oh, sorry for whoever's glass was yours, Marty.
28, 29, 30.
Okay. We got the pads on, 4 lead.
Are you a patient now or you a?
No, I saved him.
I think I'm just kind of sitting here now.
23, 24, 25, 26, 27, 28, 29, 30.
Alright, when you get a chance, can you get a airway in?
Sure. Do you want to get the airway bag out, Marty?
On the monitor, or we got V-fib on the monitor. Do I have a pulse with compressions?
You have a pulse with compressions.
Alright, gonna charge to 200. Alright, charging. Everyone clear? Clear?
Clear.
Shock delivered.
Shock. Alright. We'll get an IO in.
28, 29, 30.
Tape, but
Zip. IO is in.
IO's in. Can I get a bag of fluids?
24, 25,
still in our time frame. 1 milligram epi is in.
Epi's in.
Got it.
24, 25, 26, 27, 28, 29, 30.
All right, we got about
Good go.
we got 1 minute until next pulse check. Can I get a temperature on him as well?
Patient's temperature is 37.0, 37.0.
So hypoxia, we're breathing for him. We're gonna get a
5,
better
26,
airway.
27, 28, 29,
Got temperature.
30.
Am I
Okay, go for it.
See what you get.
Hold on, keep going. There's air in the.
just wondering about the but hydrogen ions? How long was he down? How long was he down? Do you think?
5-10 minutes.
Okay.
23, 24, 25, 26, 27, 28, 29, 30.
All right, ready? Yep. All right, we got about 30 seconds until next pulse check, so I'll give you that for the airway. Perfect. All right, do I have a pulse with compressions?
Do you have a pulse with compressions?
All right, I'm gonna charge.
21 at the teeth.
21 at the teeth. All right, charging. Hold CPR.
Holding CPR.
Still got VFib on the monitor. All right, everyone clear? Clear? Shock delivered. Continue CPR.
On a bag, Marty.
Are you good for another round? Or?
Yeah.
I can.
Okay.
I can swap in for you if that is real soon.
Also gonna get 300 of AMU.
Do we want to confirm
6
that
mLs.
So you want to go?
300 of AMU in. With
300 of amiodarone given.
For the flush. Do we have a bag of fluids?
Yeah. And we confirm placement here.
Yep.
All right.
Negative belly sound, lung sounds are okay.
Okay. Can we check a sugar as well?
Well, then, Marty, I'll
Okay, I'm gonna come in.
So once, do you want to go till the next round or do you want to break?
I can go for the next one.
Okay. Okay. You got 1 minute. Okay.
Fluids? I got fluids.
You're having a sugar. So we got airway in.
Is our end title plugged in? Or is it just
yeah.
hanging?
Ah,
Let's get end title on there.
well, for S's and G's, let's say your glucose reads high.
Reads high. All right. So we're just gonna keep running fluids. Do I have a pulse with compressions?
You have a pulse with compression.
All right. Now preemptively charge. Charge. Pause CPR.
Pausing CPR.
All right. Still have. Oh, do I have a pulse right now?
You have a pulse.
All right. Dumping the charge. Looks like we are in sinus rhythm with PVCs. Can I get blood pressure?
You cycle the blood pressure comes back 149 over 110.
149 over 110. All right, that's good. All right. If someone could hop up front, we'll get going.
Yeah.
Pause for safety check.
Yep.
All right, always pause for safety. This patient secured well.
Nope. Nope.
Let's make it so. You okay?
Yeah.
All right.
It's I'll just.
You don't want to lose your IO. You
Nah.
worked really hard to get that one.
Yeah.
We got 2 seatbelts over there, Adam. Okay. It's pretty good. He's pretty secure now, so.
Oh, this is just in the one IO?
Yeah.
Okay.
The fluids are just running IO.
Okay.
We'll get another access. If we can get an ID on that side. You think you can? Sure. Awesome. Alright. So, we're going to be cycling blood pressure in 5 minutes. How's my SpO2?
Pulse oximetry is now reading, it's always kind of been reading high. Let's say it reads 98%.
Okay. I'm also kind of thinking CO2 poisoning. CO. How are my patient's pupils?
Pupils are approximately 5 millimeters and sluggish to respond, but they do respond.
Okay. And how does like his skin look?
Skin is very blue, cyanotic in the extremities, cyanotic around the lips.
Okay.
Right? Even the sclera of the eyes looks kind of funny, a little bit of a blue haze to it. Sure.
Okay.
Cap refills brisk. What else do you want?
How's my end tidal?
End tidal CO2 is currently reading, oh, let's say it's 95.
That's high. We'll just keep breathing for him every 5 seconds. 5, 6. Alright, we can get going.
Yep.
Yeah.
We're good now.
Alright. So you said lung sounds were clear. Is there any JVD or
No JVD noted, lung sounds clear.
how's my heart sounds?
Love dub.
Loved up. Awesome. Alright, I'm not thinking tension pneumo. Thrombodes. TEMI. How are my T waves looking on this? Are they flat? Are they
Exactly how you see.
okay? Alright, we got our second site. I think I'm gonna get ready over for
You want to hold off just a few seconds and I'll step out?
yeah. Alright. What about another blood pressure still?
Okay.
About the same.
What's that?
Blood pressure?
Blood pressure comes back. Blood pressure is 124/84.
IV's severe over here.
Out of curiosity, you guys haven't done that scenario yet, have you? Okay, perfect. All right, I'll step out, get your game plan, I'll let you give your rating report. We'll be ready for you. That one was legit one of the smoothest ones for that scenario. You show up at a house with, you've got one person who is in obvious respiratory arrest, you have a second person who has a headache, and your crews see things like space haters. You grab the patient no matter what, and you get out of there. Worst comes to worst, if it's you or the patient, you get out of there.
His toxins, he was in the hospital, we don't believe that he was taking anything that he can, exposed to any